Hello, hello, hello. How's everybody doing? Hello, hello, hello. How are we all doing today?
Hello, hello.
Hi, Erica. Hello.
Hi, how's everyone?
I'm doing good. I just sometimes feel a little overwhelmed and
The
I
test
just,
or life?
oh, well, right now the test.
And
I
and
mean, life
tell
too, life too, but like, um, I put myself in this one state of mind that I just keep pushing myself to study. Um, I feel like there's so much information that even though I read it, I can't remember everything. And then when I keep going back to the studying, I'm like, then it sometimes it like clicks in like easier. Like for instance, Erickson, he
Mhm.
has 8
what
stages.
what stage are you in, Susanna?
Um, I'm not really sure,
So that's the
but
problem. That hold on. So what and not just you, I teach this all the time. I don't want
yes,
you to study to memorize. I want you to study to see it in real life. That when you're watching people at the grocery store, a client comes in and you understand what stage they're in. You do it
yes.
already. And if you try to study it intellectually, it's not
Hmm.
going to work. It's just not going to work. That's not how that's not how the test questions are written. It's really understanding the essence of the theory. So I am, I'll be 59 this month, guys. Yo, Dr. Bam, be 59, 59,
Oh
59.
yes,
Okay,
happy
okay, okay,
birthday.
okay. Yeah, okay. No, we ain't good yet. But anyway, so October 24th, my 59th birthday. And I'm trying to retire from my brick and mortar by 60. So it's a big deal just because I do not want to have to do what I'm doing. I don't want to have to stay at my college job for another year. I do not want to. God, I don't want to. So but the goal is in that stage, it is stagnation versus generativity. What does that mean?
I think it means
If
that you're looking at life in a more creative way, more fulfilled way, looking at ways you can move on and be more fulfilled, have accomplished your goals, looking at new ways to fulfill
Okay.
other dreams, desires.
Okay. So I need Erickson's verbiage. So generativity means what? You're right. I am not saying you're not wrong. What Erickson's verbiage is what? What does generativity mean to Erickson? I'm leaving a legacy. I'm worried about future generations. People who are stagnant are done. Okay. So there are people, and I think all of you have friends like, why the heck are you studying for this test? You don't need this. You're fine. You've lived 50 years without this test. Why do you need it now? And you are like, because I'm not done yet. I'm not ready to put a fork in me yet. I'm not ready for that. So when you're learning those, what I want you to do is to not just focus on memorizing, use it in real life.
I'm
That
gonna
looks like.
remember that.
Uh,
What
so
what
I,
what I'm
I will say to you, I've said that to you like lots of times because that's how I teach all the time. Don't
yes.
focus on memorizing because it's not going to help you. It's really not. You have to know them. But I get stuck in a stage. Let me show you a question.
His concept is about either you're stuck in a crisis or you're not.
Crisis is his word. Very good. It
Right.
sure is.
Crisis
Okay.
is Eric. Mhm.
So what is an identity crisis according to Erickson?
A what?
Identity crisis according to Erickson.
Oh, yes.
What does that mean?
Identity. Like, it doesn't matter what age you are, that you can still go through an identity of yourself. And that's
So
why he has two
but hold on.
verses.
Identity is a very, very clear stage. Identity versus role confusion is what age? Anybody?
Like adolescent.
So between, some books say 11, some books say 13, between 11 or 13 to 21. Okay. In that stage, I'm supposed to learn who I am. Right. And if you watch my videos or spend time with me, I will talk all the time about understanding in that stage. It's about when you're 11, 12, 13, all you want to do is be like everybody else, right? Usually I talk about, oh my gosh, what was the fad in your stage? What was the fad? What was the popular thing when you were in, starting late middle school or high school? And most of us want to blend in. That's part of what it looks like. I want to be like everybody else. But as I get older, I then think, oh, wait, I don't care. When people start high school, start college, I've got 3 kids and many of us that started college, we followed in the footsteps of a friend. We had a friend that said, oh, I'm going to major in this, I'm going to major in that. And I'm like, okay, I'll do what they do. But then as I got older, I'm like, oh, that's not really what I want to do. So the first stages is I just want to blend in and be like everybody else. By the time I'm 21, I really should be able to know who I am. So in my videos, I talk about, at 13, high school, call our girlfriends up, like, oh, what are we going to wear? Oh, we're going to wear a hair and a ponytail. We're all going to do this. Let's all get our nails done. Let's all get the famous purse. The time that you're older, you don't really care that much, do you? But there are some people, according to Erickson, it's a crisis. They still get stuck in that same stage. They don't get that. They don't ever, not until much later do they figure out who they are. Does that make sense? Let me show you what that looks like.
Yes, it does to me.
Screen. The problem with all the test questions, it's vague, and it doesn't say what theorist is which, so we get lost of knowing what they're asking me. Okay, so Susanna, take this one for me.
Sure. A client is in the development stage of integrity versus despair. The statement that would, one moment. The statement that would be most characteristic of someone with a favorable outcome in this stage would be select one.
Okay, so state my question. Now tell me what it's asking me. Always spend more time in your question than your answer. This is a recall. This is not one where I need to do the social worker planning solving model, right? This is just a recall. I have to know what they're asking me. Okay, so then tell me about, if I look at my choices, what happens in that stage? And it's an Erickson question. His name is not there, but I know it's Erickson because it's the stages of psychosocial development. So what's the question asking me?
The question is asking, they want to know the development stage of integrity versus despair.
Okay. What age is that normally?
Um, I believe it is, um,
Anybody want to help her out?
after
Age,
21.
like,
Yeah.
it's from 7
It's
to 11.
past 21, that's for sure.
Oh,
60, 55, 60.
It's the last stage.
I say late adulthood.
It's the last stage. Now,
I didn't
again,
think
we're
that.
studying Erickson. Okay, so according to Erickson, this is like 60 or 65, and in real life today, we know it's a different story. But Erickson, back then the day, people died at 70, but it's the last stage, right? It's the last stage of my life.
Okay.
And this is one that I always, instead of trying to memorize, have you not ever had a family member or not worked with a client who was too mad to die, too angry to die? They in the nursing home, ain't nobody coming to visit. I'm a firm believer that not just a firm believer, but my personality doesn't change. If I was a rotten SOB when I was 20, 30, 40, why the heck would I expect someone to turn up the nursing home? My kids ain't gonna wipe my ass if I was nasty to them my entire life. Right? Y'all might have some cultural family beliefs, blah, blah, blah. But Erickson said, at the end of my day, I'm either happy with the choices I've made. That's I'm in integrity, right? Ego integrity. My ego is good. I was a good mom. I gave everything I had to my kids. I had a good job. Or I'm in despair. Where damn, I ain't nobody at my funeral because I spent all my time at work, or I shoulda, woulda, coulda. Ego integrity versus despair. So that's what I need you to know before you look at any of the answers, is that's an Erickson stage. Okay, again, do we know people in real life? Either I've worked with people dying, I've worked with hospice, or family members that they just too mean to die. Come on, give me some props. Come on, put it in real life. Put it in real life.
Yes.
Erica, I know all of your family is amazing, right? And you never had anybody in your family that was just nasty at the end.
Yeah, I have some. Yeah, there was some.
I'm not trying to get in your business. I'm just trying to help you pass the test, to not take it as this thing over here, to understand this is what happens. So I again, in nursing homes, I'm a believer that people that don't have anyone to come visit, there's a reason. There's a reason. If you were a good mom, and I'm not saying perfect, I'm just saying if you raised your kids and you put effort into them and you showed up on the days that you could, and you were there for them, they're going to be there for you. It don't mean they're not going to put you in a nursing home, but it means that someone's going to check on you.
Some regret that old people may have, may not always be their attitude, but regrets can be also some of the things that culture has placed on them and during their days that they were not able to. Like those deep regrets of decision that they couldn't because of culture. I've heard old people talk about my days in nursing home, like during their day, they didn't have those opportunities that women have today. And so they just live their life on a one person in one marriage. And sometimes they wish they would have left and all of these different things. So if I put them in that stage, then it's not always that.
Oh, you're bringing Trudy into the question. But I'm going to say again, ego integrity is I made the best decisions I could. I'm good with my choices. I understand that I messed up. I understand that my dad, I asked my dad, my mother died when I was young. And when I had my first kid, I said, hey, so your labor is very much like your mother. So I asked my dad, I'm like, so what was it like when I was born? He's like, I don't know. Man didn't go to the living room. I don't hold that against him. That was the time, right? He didn't do anything wrong. That was the time. So that is that. I think that's a cultural thing that we can look at. I was born in 65. Men did not have anything to do with, they were nowhere around. Okay. However, there are adults who, as adults, are still not taking ownership for their choices. Yeah, I messed up as a parent. I did. I did the very best I could do with the knowledge I had at the time. And I think all parents do that. I do. I really do. But if I go to my dad and say, hey, you know what? You molested me as I was a kid. And dad says, that didn't happen. That's someone who's probably not going to have a lot of people visit them in nursing homes. So that's what that despair is like. Things I wish I should have, could have done. And now I don't have the opportunity to change it. And I think we're all in the field where we know we don't expect perfection, do we? We expect people to show up, but just show up and be, and, hey, my kids took me to therapy and a half. I apologize for all the things I'm sorry that I didn't have, but most of us and all parents give that best. They give the very best of what we have at the time. So if I'm in despair, remember I'm 70, 80, 90, and I had 50, 60 years to go back and look at my stuff. And I chose not to. So then a client is in the developmental stage of integrity versus despair. And I'm going to just say it to Trudy, you are absolutely right. You're absolutely right. But the test is not about you. The test is not about culture. The test is based on white upper class people. We know in nursing homes, we don't find a lot of people of color, whether it's Black or brown, Asian. We don't find a lot of people of color, do we? We don't. Okay. So then, a client is in developmental stage of integrity versus despair. The statement that would be most characteristic of the favorable outcome. What does that mean? The favorable outcome?
Favorable is, I'm gonna go with integrity.
Absolutely.
Because
the favorable outcome is
positive.
I was integrity. Good. So then let's read all four.
I regret so many of my choices. I'm going to take that out because that's despair.
Okay, I'll read all four first. Read all four first.
For those who come after me, I hope I've done a good job, possibly. Overall, I feel like I've made the right choices, possibly yes. Generally, I feel that I've been a productive human being. That also can possibly be correct.
Okay. So
However,
hold on, Susanna, go back. When you read the questions, don't read the questions with judgment at all. Just read all four. Like I have no idea. Okay. You understood the question. And now you read all
yes.
four. Okay. Now I'm going to go back and take out no way, no how is the answer.
I'm going to take out letter A. I regret so many choices because
Okay.
that's despair. So for those who come after me, I hope I've done a good job. I would say, that is a
I'm
good
gonna
answer,
take that
but
out.
it's not.
No, I'll take that out.
It's
You know why?
not most. It is not the most
Because
because
hold on.
oh
That's
sure.
a different stage. What stage is that one? Anybody? I'm worrying about leaving a legacy. I want it to matter that I've been on this earth. That's the prior stage. That's stagnation versus generativity, right?
Yes.
So that's why it's out, because that's not about this stage for those who come after me. So in the earlier stage, the stage that I think I'm in, I think you're in also, Susanna, is
Yes,
I want my life to have mattered. So that's stagnation versus generativity. So that's why that's out. So now we've got C and D. Let's keep going.
So overall, I feel like I've made the right choices. Possibly, yes. generally, I feel that I've been a productive human being. So I'm gonna still go, the productive human being is still a different stage.
Really?
Well,
This is one of those questions that says the most. The
okay.
best is, right? So that means C or D are both pretty close. So I got to figure out which is the best is or the most is answer. What would Erickson say?
Okay. Integrity does mean a productive human being.
Are you sticking with D?
Okay, yes, because letter C, overall, I feel like I made the right choices. Is still, it's a little
Yes.
undecisive. And
C's my answer.
overall-
C's my answer. C's my You're thinking. Erickson talks about either or. You're either in industry or versus despair. You're either in stagnation versus generativity. You're either in intimacy or integrity. Intimacy versus role. Intimacy versus isolation. Either or. So you decide what stage you're in. So the answer is C. I made the right choices. I didn't get stuck in a stage. It has nothing to do with whether you're a productive human being. That makes sense, but that's not what Erickson said. Erickson said, I went through all the stages appropriately.
Okay.
Okay. And that is one of the ones, just knowing what the theory says, what that theorist would say. And this is one, I'll get back. People come, Dr. Pam, I didn't have any Erickson questions on my test at all. You made me study him, and I didn't have any because nowhere in the question do you see his name. And if you don't understand Erickson's theory that says either I am mistrust versus trust versus mistrust. And if I don't get through that stage, I can be a grown A adult and still not trust people because I get fixated. Crisis. I get stuck in a stage. I know. I swear I don't make it up. I'm just trying to teach you what the theorist said.
I learned something right now.
The questions are based
How
on
to
what
understand
Erickson would say.
how to understand the theorist
Because you need to spend time
concepts.
understanding Erickson. Every question is based on a KSA, a knowledge, skill, or ability. Not what Susanna would say, not what Dr. Pam would say. What does Erickson say? Did I give you guys a test last week in your chat box? Which one did I give you?
4, I think.
Okay. Ask me questions. Something again, whether it's we're going to go over that, but if there's something you've studied, something you've seen someplace else, ask me questions. Let me explain to you how we got there.
You give us the answers in the group or in the chat after we do it, or
I don't think I put the answers for 4, did I, in the box?
okay. I'm just looking to see what I'm doing.
So in last week's in your chat box, did I put the answers for 4?
I didn't see it.
I don't usually because most of you think that taking test questions is actually studying, and that's not true. So I purposely don't usually give you those.
Okay.
What was in the chat box last week, guys?
One moment.
Did I put questions in the chat box on? Vicky, what did you study this week?
I focused on the questions for exam 4 that you
Okay.
had in the chat box. I
Very
did more
good.
of those questions.
Did I put the answers in there?
I didn't see answers,
I did. I purposely, that was my goal, is to not put those answers in there. So,
but I printed the test the day after last week's session.
mhm.
I haven't really gone back yet. So I have the printed test exam in front of me.
Okay. So let's go over that. That was my goal today, was to make sure that that everybody was able to work on that test.
Okay.
And
Yes,
did everybody work on that?
I started it, but didn't finish.
I worked on it myself. I didn't finish all the questions.
That's work out all right. Okay. Erica, Trudy, Tasha, did you work on it?
I work on it. The one I printed out.
I just got them because I was sick. I had bronchitis. So I started.
Erica, did you miss work this week?
Yes, I missed the entire week.
Oh my gosh,
That's-
baby.
Yeah, so I'm trying to like look at all the questions you've been putting on the dashboard and reviewing
Mhm.
them and trying to catch back up.
So I will always say, if you're too sick to go to work, when your kids were little, if you're too sick to do anything, y'all need to just watch the videos. You don't have to do a test.
Yeah, I was watching your latest video that you put in the dashboard, with some other members from other groups, I think.
Mhm, mhm.
I was watching that one this week.
Okay, let me pull this one up. Does everyone have the test in front of them?
I don't. I'm trying to see how I can log in, because when they send you the link, it doesn't stay there. And
In the chat box, it does. It should be there forever, not on Zoom, but in your
do I go to Pearl?
yes, it should be there totally, always, forever.
Okay, I'm trying to navigate Pearl.
Pull up those. Does anybody have any questions? Please tell me that you spent some time studying this week, whether it was stuff I gave you or video, or you took some test questions.
I did some of the test questions. I read up to some of the
Yes.
research questions, and I really wanted to. I don't know how we're going with the structure, so
So the goal is that when I put test questions in the box, that we'll go over the test questions. And then I answer them and we'll go over, but I purposely don't give you the answers, because most of my clients just want test questions and don't want to get them right. And that's not what I want. What I want for you is to be able to understand the question and then focus on
well,
why it's the right answer.
there are 2 questions in there.
2 sets.
2 different tests. I printed them out. I started them. They're very long.
Yep, they are.
So I think I did up to 25, but I left my flyer on my desk this afternoon because I went to a training and came straight home.
Okay.
But I
I've
printed
been
out
reading.
So hold on. Let me, so the goal is that we study 3 hours a day, every day, right? That's the goal. So leaving those test questions at home shouldn't affect how you study all week.
I read up, I did my flashcards. Like I said, I had the research method, I had engagement and other things that I did, a whole bunch of flyers. Then I did the test question in between, because I get on the train in the morning. So I like to take my flyer with me.
Okay.
When I'm on the train to answer questions. That's why I left it at work, because I take it with me, and then during my little break at work, I try to do the best I can do, because I'm also a parent of 3 children. So
Girl, I understand. I understand more than you'll ever know. So my Mother's Day video, I keep talking about that. What I encourage people is to put yourself first for just a little bit, just a little bit, just a little bit. I understand. I really do. I understand more than you'll ever know of not knowing who I was and not making myself a priority. I understand. But I also understood that what I was doing was the legacy of what I was leaving my girls, especially. That if I didn't say to my girls, mom has to study, they would never learn that mom's a priority. That women, it's okay to put yourself first. And that was very important to me. Because we don't do this forever. It's not forever. It's just a brief period of time. And then we're done. Okay. Susanna, do you see Aaron?
Do I see Aaron?
Am I sharing my screen?
Sure.
Okay. Did you answer this one already?
Oh, I can do it though.
Okay, if you answered already, this is the same test I put in your chat box. So read it and tell me whatever you already answered.
Okay. Harrison is meeting with a new client. Harrison knows that his client has had problems with drug use in the past due to his client's arrest record. Aaron is planning on gaining sensitive information during his session with the client in order to move toward an effective intervention in a timely manner. Which of the following is the best explanation for why this might not work for Aaron? So, the problem is a drug use, and it's based on the client's arrest record, and it's Aaron is planning on gaining sensitive information during his session with the client in order to move forward. So the worker is Aaron, what his information that he gets is from the client's arrest of a drug past, that he's had a drug issue in the past. But now he's trying to move to the next step of the session in order to move forward. He wants to have an effective intervention in a timely manner.
Okay, so I
So-
still need you to put this in your own words. I think you're reading the
Yes.
question, but I'm not sure that you still understand what it's asking you.
Okay,
Okay,
so
in your
he's
own
looking-
words.
he's looking for an effective intervention
Okay,
for
based
his
on what
client.
problem?
Based on that he has a drug issue.
Okay, and what's
And
the
the-
question asking me?
Which of the following is the best explanation for why this might not work for Aaron?
What might not work for Aaron?
To have an effective intervention in a timely manner.
Okay, I'm still lost. Tell me in your own words to understand the question, because I'm thinking, what are you asking me?
Okay, so Aaron is in a meeting. He's meeting a new client,
Got it?
and the only information that he has is an arrest record. So he's trying to have an effective intervention, but it's also, he's trying to do it in a timely manner. And according to the question, it says the best explanation for why this intervention in a timely manner will not work for Aaron.
Okay, okay, so read all
And
four.
the reason what I'm gonna from the question is, according to drug use, it is not a quick type of intervention.
Okay, okay, good. I like that.
So we're focusing on different methods of interventions.
Okay. So the question says, what I did so far may not work. Why? How come? Give me a reason why it won't work. Right?
So, and you know, he's had problems with the S, so it has happened more than once.
Okay.
according to the question and possibly the arrest record.
Okay, very good. So let's read all
So-
four.
Letter A, Aaron's client may be offended that he looked up his client's arrest record prior to the meeting. Letter B, Aaron should let the client self-report using the SASSI-3.
Do you know what that is? The SASSI is a substance abuse assessment. So it's asking him about his substance abuse. Okay.
Okay. Aaron's first needs to build a rapport with his client. Letter D, because of the client's tendency to express denial and resistance, Aaron has no control over the client's motivation to give a sensitive information.
So what can I rule out for sure? No way, no how. This is the answer.
Okay, so I am going to take out the letter B because we are not at that level or that stage where we're gonna just jump in to do an assessment when we haven't had the report to just jump in and to do an assessment.
Okay.
We don't even know, like, we need more information from the actual client.
Okay.
So Aaronson's client may be offended that he looked up the client's arrest record prior to the meeting. There's nowhere in the question that states about him being offended.
But it does say he looked up his prior record, right? It does say that.
It says it looked it up, but it doesn't say that the client may be offended.
What I hear is that you picked question, the answer C, because you said rapport already. Tell me
Yes.
why you picked that. What words in the
Because-
question? Prove that to me.
Yes, because first of all, he's a new client.
Okay.
And as we already know, like we can't just jump into conclusions or like, you know, send somebody.
No. All I want to know is what words in the question.
Oh, yes.
Prove it to me. What words in the question?
Okay, a new client
He's new. Okay.
and sensitive information.
Ah, okay. So sensitive information is the issue. That's the key, what I'm looking for in the question. We just met, right? Sensitive information. Hey, Susanna, can you tell me when the last time you had sex? Don't answer that. Don't answer that. I'm just joking, okay? But we don't start off with that, do we? Sensitive information are things that we got to work ourselves up to. We don't start off with telling the gross, nasty details of your intimate life. We don't start there. So that's the key in the question because it's the first session and it's sensitive information. So before I ask that, we got to have some rapport, right? Everybody see why that's the right answer?
Mm-hmm.
Okay. Absolutely. Very good. The best explanation is why it may not work because we just met. I can't begin. And the key in the question was sensitive details. Good. Good job, Susanna. Very good job. Okay. Number 2. If you've done these already, you can just tell me your answer. Erica, did you do this one?
Let me see. Oh, this is the one that I didn't like this question.
It's number 2, girl.
But I did
How
it.
come?
Probably
Okay.
not.
Well, what was your, do you have your answer in front of you?
So
Yeah, let me open up my.
Or you can read it again.
Okay,
It's fine
yeah.
by me.
I mean, now that my brain is functioning again, I don't think that was the right answer. So you want me to read the question?
I would like
Start
to.
with reading.
I want to support
Sherilyn.
you. You tell me how I can best support you.
Sherilyn. Yes, I'm gonna read the question and then I'll tell you the answer that I originally selected. Sherilyn, your client of 6 months, tells you that she's recently begun having an affair with Tony As she discusses their affair, you realize that Tony is another one of your clients whom you've been seeing for the past year with his wife and 2 teenage children. In order not to contaminate the therapeutic relationship with Sherilyn or Tony, what would you do?
Oh, this is a code of ethics question.
So
Ah,
I had, yeah,
okay.
it's a code of ethics question, but it's the answers that I was kind of confused with. So let me read through.
So hold on, explain to me
A.
first. And
A
now,
says to
no,
gently.
no.
Go ahead.
In the question, tell me in your own
Okay.
words what's happening. Always tell me to stay in the
What's going
question
on?
first.
All right.
What's happening?
All right. So the social worker has these 2 clients. All right.
Got it.
Sherilyn, she's had this client for 6 months.
Got it.
And Sherilyn is getting deep into the session, telling her that she started an affair. So as she's giving details, the social worker uncovers that she's with another one of her clients who is Tony, and Tony is married, and she services Tony, his wife, and the 2 kids. So now she has like a little I don't know if it's a conflict of interest or
So
it's a
this would be,
conflict
so it's a
because she has
conflict, but
these
it's not a
2
conflict.
clients.
Hold on, it's not a conflict of interest. Conflict of interest
She
talks about
knows their
money.
dirty secrets.
Okay. So in this question,
But
that
it's not a conflict of interest.
it
Yeah,
is not a
it's
conflict of
not.
interest. That's money, but time matters.
See,
Cheryl
now
said my
she has
client,
to
hold on.
make a judgment of the situation.
Okay, so Cheryl is my client for 6 months. Okay, but I've been seeing Tony for a year. Okay, can I get rid of either one of them?
Longer, yeah. So
Can I get rid of either one of them?
can you get rid of?
Yeah, can I say bye-bye,
wanted to.
adios? No, I cannot.
You
I
shouldn't terminate. I mean,
Okay, so don't look at my
unless you have
answer.
like counter transference.
Even that's not a reason to terminate. I cannot.
No,
The client,
definitely.
I can't terminate a client because my
So-
stuff gets in the way. Hold on. Can you listen? Just listen for just a second, okay? If
Mhm.
if I've been seeing Tony for a year and Cheryl just started, I could say to, hey Cheryl, bye-bye, go see somebody else. Right? But I've been seeing Cheryl for
Mhm.
6 months and I've been seeing Tony for a year. I can't get rid of either one of them. So if Cheryl came to me and said, "Oh, I got this affair with this man. His name is Tony," blah blah blah. If it was our first session, I would say, "Bye-bye, Cheryl. Go see somebody else." But I can't do that because it's been 6 months before I realized, and I've been seeing Tony for years. So those time frames matter. It matters. So I cannot say goodbye to either one of them. I don't get the right to terminate a client because it's uncomfortable for me. My medical doctor sees me and my brother. I referred my brother to her. I've seen my medical doctor probably for 15 years. 15 years. She sees my brother too. She can't get rid of either one of us. That's not okay. So understand the question before you understand the answers. It's been a minute. If Cheryl said, "Hey, I got this blah, blah, blah coming up," I can say, "Cheryl, bye-bye. I don't want to see you." But I've been seeing both of them now. It's a code of ethics question, which is the best ethical answer. Now read all 4, okay?
A. Gently terminate with Sherilyn without telling her why. This preserves confidentiality, and since you've been seeing Tony and his family longer, you owe them more professional allegiance. B. Say nothing and continue seeing both clients while you monitor your countertransference and ask colleagues for assistance with the case. C. Call an attorney and discuss legal issues around dual relationships so you can determine the best action to take. And D. Continue seeing Sherilyn as usual. Ask Tony in for a private conference so you can ask about his commitment to his marriage and family, being careful not to break any confidences.
Okay. What can I rule out? No way, no how is the answer.
A.
I cannot terminate with Cheryl. I've been seeing her for 6 months. But remember, every question is different. If it said I met Cheryl yesterday, I can't terminate. But I've been seeing her for 6 months. So A is not an option. Good. What else can I take out?
C.
I would not do that first. I might do that, but not first. Okay. So now between B and D, between the two of those, when I get down to two, I'm going to pair the two to each other and come up with the best answer.
Yeah. So is it B?
Okay. What's wrong with D?
I mean, like, so, you want to keep seeing both of them. Confidentiality is important.
Well,
Why
well,
she
hold on,
wants to ask
hold on,
Tony
hold
for a
on.
private conference. I mean,
So what is B is your answer? You're absolutely correct. What's wrong with D? Why is D not the best answer? What's wrong with it?
because she sees Tony and his wife and his kids. So isn't that like family
So I
therapy?
can't see him. Yeah. Yes. I can't see him for a private conference because my client is Tony's family. I can't do
Family.
that. Yes. Okay. Did everybody get that? Because these are ones that most people struggle with 1,000 times. What makes it wrong is I can't see Tony because Tony presented with his family. Can I see him by himself? Never, 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 because the client is the family, not Tony. Very good job, Erica. Very good job. Anybody struggle with that one, or you guys all got it? This is one that most of my clients miss. Everybody good with that? Ask me. You paid a lot of money to spend time with me. Does that make sense?
It makes sense, however, from the code of ethics, it seems a little confusing,
What code of ethics did this violate?
Well, the thing about, confidentiality and things like that.
You're grasping at straws, Susanna. The code of ethics says whoever presents to me is my client. If the couple presents to me, the couple's my client. If the
Yes.
family presents, the family's my client. If the community presents to me, the community is my client.
Mm-hmm.
Okay. A lot of you in your business every day will see kids or families, couples separate, but the code of ethics says if the family's the problem, we see the whole family. And I'm seeing the families. I cannot see Tony separately. That is what the code of ethics says verbatim, verbatim, verbatim. All of you that see people separately or clients separately, that's how you get through everyday life to get paid, but that's unethical. The code of ethics says we don't do that. Okay, Trudy, this is yours.
We did this question last week.
What was your answer?
It was A.
Very good. Let me give you another one. Thank you.
You remember?
Not at all. Not at all. I am so sorry. Let's see. Did we do this one last week? I wish I did. I so wish I did.
Which one? This one?
Anyone? No, anyone. I'm sorry.
Some of them, as I was doing the test,
I
some of
think,
them we
sorry.
did, some of them we did not. So,
How about that one? Lenny?
gambling. I believe we did this gambling one, but I'll try it because I don't remember.
Okay.
Lenny said he cannot stop gambling. Lenny said his wife has left him as a result of gambling, that he got fired for stealing money. I think we did this. For stealing money he needs for gambling, and that when he is not gambling, all he think about is gambling. Your next consideration will be. So we know that it's identified here that he's gambling, and that one of the primary issues is that he's also stealing money that he needs to gamble, and that his family has also, his wife has also left him as a result. So it said, what would we do next? The next consideration. So that's the next question. You always say assess, assess, assess.
I think if we did that one, that's the answer, right?
Yeah, we had one gambling last week.
Okay, let me give you another. I'm gonna go from the bottom up. How about, oh no, sorry. Try that one.
Doing supervision with Roberto and LCSW asks everyone to look at their documentation and to get ready to share their cases. David, an associate, realized he has left his briefcase with the documentation in his car. He raised his hand and asked to go to his car to get them. What should Roberto do next? So they're in a supervision. Seems like it's a group supervision. I'm not sure. They asked everyone to present, and David here left he left his stuff in. So that's a court of active question to me.
It is.
He left his briefcase with the documentation in his car, so that's a privacy issue, but I
Okay.
should put myself in, but that's a court of active.
It is. And I know it says next, and I was thinking, what would I do first? I'm in a supervision, and he says, oh, right. My notes are in my car. What is your first thought?
Ding, ding, ding. He's not supposed to, like, your notes not.
Why are your notes in your car? That exactly. That was my first. Why are your notes in your car? That's my first thought. Okay.
Yeah.
So then, what would I do? I know it says next, but what would I do first?
Take a break and let David go to his car to get the documentation. Let him pass this time and ask him to bring them next week. Do nothing and go on with the session. Explain clinic policy, and that documentation may not be taken out of the clinic at any time. So it's next, but it's also first. So that's
Ding,
a
ding, ding. Yeah.
violation. So
Let's roll out.
I will not do the A first.
Okay.
And I will not do B.
Okay. So now between the C and D, that's where I want you to be. Okay, between the C and D, which one of those is the best answer?
D will be the best answer because you got to go over the policy.
Absolutely. And in general, do nothing is pretty much never the right answer.
Yeah.
Good. Very good. Good, good, good. Good, good, good. Anybody got any questions with that? That was totally learning the roles of supervision as well as code of ethics. That's what that question was measuring. Good. Sophia.
Sophia.
Yes, Sophia.
Okay, so Jake, a new associate social worker at an inpatient rehab facility, dreads meeting with his supervisor Bob each week. Bob tends to point out all the things. Is it Jake or Jack? Jack?
I think it's Jack.
Okay, Jack is doing wrong and rarely commends him.
Okay, I'm going to take this point. The term is called immediacy. When you kind of point out like an issue in the moment. I'm sorry. How is your name spelled?
Immediacy.
No, how is your name spelled?
Safiyyah.
Could that not be spelled a much easier way?
Yes.
I'm just gonna call a spade, okay? So immediacy is a teaching moment, okay? It's just Jack.
Okay.
His mama could have spelled it Jakiaha, whatever how she chose to spell it, okay? But immediacy is the term of learning in the moment. Did you have any control of how your mom spelled your name?
No,
You
my
did
dad
not.
actually did the spelling.
But you have no control over that, right?
No,
So I always
I
think
don't.
that's funny with names, okay? I always think that's funny when people have, I think, kind of strange spelling names. I'm like, how come you don't know Jack? So immediacy is taking every moment we're there and turning it into a teaching moment. Okay, so Sophia, it is just Jack. Okay, go ahead.
Okay. Jack, a new associate social worker at an inpatient rehab facility, dreads meeting with his supervisor Bob each week. Bob tends to point out all the things Jack is doing wrong and rarely commends him for doing things right. Bob recently told Jack that he needs to be more conscientious.
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 Yes.
Conscientious.
Mhm.
When completing his chart notes, that he might use third person phrases such as this writer, this clinician, this practitioner, or this social worker, and avoid using me, myself, or I. Jack avoids his supervisor as much as possible because he feels like Bob is too critical. Jack should. So, staying in the question, Jack, he's a new associate social worker at an inpatient rehab facility, and he dreads his supervisor Bob because he doesn't say anything positive about his work or like completing his chart notes. And he complains that Jack writes in third person instead of using the phrases me, myself, or I. And Jack avoids. So what he should do is find a new.
No, stand my question first.
Mhm.
What are they trying to measure this question?
What Jack should do about his supervisor Bob.
It's a code of ethics question, right? Okay. So if I have a concern with my supervisor, what should I do first? Do you get that?
Yes.
Okay. He's my supervisor. And he says, oh, I want you to write this way, this way, this way. But Jack is avoiding his supervisor because he thinks he's too critical. Okay. Anybody have a supervisor that you hated? Me. Okay. So then the question is measuring. He avoids his supervisor. So what should he do first? I know it doesn't say first, but what should I do? And it says, I'm new. Things that matter in the question. I'm new.
Okay. So A, find a new supervisor. B, send Bob an email in which he delineates.
Delineates, okay? So
Delineates.
delineates all the success with individuals. I'm going to send my supervisor email. I am Bob. I have done all of these great things in life.
C,
I'm
open.
Jack, and I'm
Okay.
sitting Bob, okay?
C, open a dialogue with his supervisor and assure him that he has successfully completed clinical applications during his internship. D, request and adhere to feedback from his supervisor.
Okay.
So, eliminating, I would go with,
well, stay on my question. Stay on my question. How long has Jack been in the field?
well, I'm assuming not so long because he's new.
About 15 minutes. So I'm gonna say, okay, I'm trying to exaggerate, but he's new, right? So despite Jack, yes, Jack thinks he knows everything because I got my LC, my MS, whatever, but he's been in the field 15 minutes. Okay. And his Bob says, hey, I think you're doing this wrong. And I want you to look at using the writer, the clinician, or this practitioner. And when he says it to him, Jack says, I'm just going to avoid you. Okay. What can I rule out?
So I would rule out A, find a new supervisor.
Okay.
I will also eliminate B, send Bob an email in which he delineates all of his success.
That's going to go well with my supervisor, right? I was great this weekend, this and this and this.
Yes. So, just looking at one of the answers, C, open a dialogue with his supervisor and assure him that he has successfully completed clinical applications. D, request and adhere to feedback from his supervisor. So I would go with D, request and adhere to feedback from his supervisor.
Oh, that hurts, doesn't it? Doesn't that hurt? Haven't you all had a supervisor that said some things that you didn't like?
Yes.
It hurts. It hurts. Like, it hurts. It hurts. We take it personal. So, but he says to me, I'm new, and my supervisor says, hey, can you look at this, this, and this? It hurts. It's hard. I take it personal. But I need to believe that my supervisor is doing what's best for me. Is that always the case? To the no. We have some sucky supervisors, but in general, for the test, that's the best answer. Okay. Okay, I got to run outside because I think I left my sprinklers on. 50 you can do together. I'll be right back.
Thank you. A 50-year-old male client tells his social worker that he completed a homework assignment given to him during the previous session. He read the list of the pros and cons that he has come up with regarding the possibility of him leaving his very stressed job to remark on a new career. The social worker noticed that the client has some reservations about making the changes, but says he feels some more hope about possibility and is starting to consider what the change will be like. Which stage of change is the client most likely in? So this is in stages of change. So the client is 50 years old and he is meeting with a social worker because he have an assignment from previous class. He also have a list of pros and cons regarding the possibility of leaving a very stressful, repeatable new career and then going to the next. So At this point, and then it said the last sentence that the social worker noticed that the client has some reservation about making the changes. So that's like a key to me, ding, 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 some reservation. So he's not ready for change. So to me, A is the actions, pre-completion stage, which is somebody want to change, but they don't want to change. That's A. So I will pack it. B is action stage. I don't think he is at action stage, so I will cancel that. C is evaluation stage. I don't remember evaluation being part of stages of change, so I'm going to cross that out. Complication is the second stage. I don't see him, though it said he has some reservation to make the change. He feel more hope about possibility and is starting to consider what change he would like to. So he's still making plans. I think between A and D, A is when you have an issue and you know you have an issue, but you are not ready to change, or either you have an issue and you are not aware of the issue, but I think you're aware of the issue, but you're not ready to change. And complication is more of I accept the change, moving towards the change. So I'm gearing to stay in A because he said there's some possibility he's considering. I don't know. I'm between A and D. That's all I can say. I'm scared to say A and I'm scared to say D. So anybody else?
I think it's D because pre-contemplation would basically mean that he's in denial. And this doesn't say that he's in denial because he's already made a list of pros and cons and thinking about, what the change would feel like. So I believe it's contemplation, like he hasn't really made a commitment to make the change. However, he's making steps towards making the change. So I'll say D, that's my answer.
Yeah, I think because you said he made some lists, that's kind of ding, ding, ding in my head too, that he's making some sort of action. So these tend to be the strongest.
Yeah, contemplation.
It
Mhm.
says he feels some more hope.
Anybody else?
Well,
I think it's the
yes.
Yeah,
of that
we can't hear you, Vicky. You're breaking up really bad.
Stricken notes that the client has some of the
Didn't hear anything you said. Sorry.
me.
Well, my idea is pros and cons
Oh,
does not mean evaluation.
I think it's D because of that line that says the social worker notices.
Contemplation means
Yeah.
they're thinking about it. There's pros
Yeah.
and cons doesn't mean thinking about it. And
But you see the possibilities
pre-contemplation.
though, Susanna. I can't.
Huh?
Possibilities of it.
I'm sorry, what?
He sees the possibilities.
Okay, see, everyone sees something different.
Well, I was also gonna say D two because he completed the homework assignment that was given to him during the previous session. So, a person in contemplation, they see that there is a problem, but they are experiencing that withdrawal, or what will that change look like?
This is called the trans theoretical model. This is where motivational interviewing came from. Many of you use it every day in your life and not knowing what it means. So what used to happen is in that pre-contemplation stage, when people didn't think they had a problem, we would say, what the heck is wrong with you? We would berate you, call you every nasty name in the book. You're stupid, you're an idiot, blah, blah, blah. And what we know now is, nah, we don't do that. We try to motivate them to understand why it's a problem. Okay. So then, what was the answer to this one, guys?
We all said something different, kind of.
Well, it's a reading test. There's only one right answer.
I said it's D.
You said it's D. Majority vote says D.
Okay.
Contemplation.
So what words in the question? Prove it to me. Prove it to me.
Well, I say it's D because the question's asking what stage is he most likely in. He's a
To what?
female male client that
Okay.
tells the social worker that he has completed the homework assignment given to him during the previous session. Sophia pointed out a good point that if it was pre-constipation, he wouldn't have completed the homework assignment.
Ding, ding, ding. He would not have, because I don't have a problem.
Right.
Okay. Is he doing something?
It says he reads a list of pros and cons that he has come up with regarding the possibility of him leaving the very stressful job to embark on a new career. The social worker notices that the client has some reservations about making the change, but says he feels some more hope of possibilities and starting to consider what the change will feel like. I said that's D. I think Trudy, you all said it was D. But it's not A because he's not taking that much action yet. But
Okay.
it's not C because it's nothing to really evaluate.
Evaluation is not even part of the program. That is not even an option, right? Pre-contemplation, contemplation, I make a plan, right? And then I act, and then hopefully I maintain the problem. If not, I go back and I have to go back and start over. So evaluation is not even part of that transdirectional model. Okay. So D is my answer. Everybody see why that's right? Those of you that struggle with that, do you see why that's the best answer? It's the trans theoretical model. It was written for drug and alcohol users. However, we use it for anyone who's in the stages of change. Okay. If you watch any of my videos, probably this is in theories. I talk about COVID, and maybe during COVID, I might have gained 20, 30 some pounds, right? Maybe. Okay, but I
I didn't even recognize my cohort.
I'm gonna say so when COVID was over and I had to go back to work and nothing fit, I was in pre-contemplation. I don't know what y'all talking about. I didn't gain no weight. I had a personal trainer, even during COVID. I had a home gym. He came to my house. He worked me out, blah, 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 blah. I ain't got a problem. Okay. So then what happened is, let's flip that theory, called the trans theoretical model. And it was written for drug and alcohol. I'm sorry, it's not trans theoretical. It's trans theoretical model. It was written for drug and alcohol users, but that is not all we use it for.
I know I read that, but I didn't remember it. And right now, when I saw the question,
So this is one that, again, you use every day. You have clients who come in who say, I don't have a problem. It's not about memorizing. It's about using it every day when you see clients. Okay. I know, just me. What happened was, COVID was over. I had to go back to work. I've been wearing sweatpants for a year and a half. had to go back to work. And some of my dresses did not fit. I know it's just me. I know. Now all y'all was fine. All y'all, none of y'all gained all day all during COVID. Okay, so pre-contemplations, I don't have a problem. I know what you're talking about. Contemplation is, I got some really good girlfriends. Oh, girl, you got some spray. Maybe you shouldn't wear that dress. That's what they say. No, I worked out during COVID. I worked out. Yes, I did. I did work out 3 times a week, but I ate like 17,000 times a day. COVID was great. My area, you could not buy before during COVID. Before COVID, you could not have alcohol delivered. But during COVID, I could order food, and I sent you a picture of margaritas. It was great. It was great. So contemplation is when now I'm going back to work and I'm trying to figure out my favorite pair of pants. And I'm like, oh, right. Oh, they don't fit. Okay, I have a problem. So then once I realize I have a problem, I prepare. Okay, Pam, so what are you going to do? You got to lose weight. You got to get back into the pants. What are you going to do? Okay, call AA. I'm sorry, I call Weight Watchers. I call whoever has a discount, whatever the deal is going on, and I make a plan. I can act in that plan, and I'm usually good for a couple of days. I showed up, hey, went to the gym, a couple of days, and then on Friday at work, somebody brought pizza, and I ate the entire pizza, and I relaxed. So the goal of this theory is that the assumption is I'm trying to change behavior. Okay, so I need you to first recognize it's a problem. The term ambivalence is one thing you'll see very often. Ambivalence is where I'm stuck. Oh, ambivalence means I'm not sure it's a problem. But once I realize it's a problem, then I'm going to make a plan. I'm going to action. If it doesn't work, I got 2 choices. I can come up with a different plan, or I can repeat the same action. Okay. This is where MI came from, motivational interviewing, that many of you use every day in your therapy, but it came from this theory of helping clients realize they have a problem. Okay, so are we good with that? To see where that theory comes from, and can you use it in everyday life?
Yes.
Everybody else, that's what I want you to do, is just understand what it looks like in everyday life. We're not trying to just memorize questions. We're trying to learn theories that we already use. Someone tell me that you've used this in a life, a client who's not necessarily a drug or alcohol user, but doesn't want to make a change. Domestic violence victims are good. They don't want to leave.
But then family systems,
Say again?
there's some.
Vicky, I'm sorry, it's not so great.
You hear me now?
Try again.
With some of my patients, they have family relationships that are not the best, like mother, daughter, father, son, or father, mother.
Okay.
And they are not ready to make decisions or make changes to better that relationship.
What theory, if it's generational, what theorist is that?
Generation.
That's Bowen. Bowen talks about the genogram, and right, that it's so hard to make changes. So we talk about family therapy, and Bowen, we tend to do whatever Mom and him did. And if Mama stayed in domestic violence relationship, she says to me, "Girl, it'll be okay. Just stick it out." So that's a Bowenian question. It's intergenerational. You do it all the time. I am never pretending to ever make you a better social worker. I'm trying to make you a better test taker of understanding what the question is asking me. Okay. Tasha, is this yours? Harm reduction? Who had the last one?
It was everybody, but I can give this an attempt.
Get you. Okay, so let's say read the question first.
Okay. Harm reduction as an approach provides non-judgmental and non-coercive services to people who use drugs and alcohol. This supports some of the most fundamental aspects of social work practice, which are.
Okay, so what is harm reduction? Have you studied that? Have you seen that term before?
Yes, harm reduction is most likely for people addiction issues, where basically the goal is not abstinence, but basically minimizing risk of
Okay.
like overdose.
You're absolutely right. Can I tell you that wearing bicycle helmets is harm reduction?
Yes.
Okay. Harm
And elbow
reduction
pads
is
and knee pads.
ding, 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 ding. Okay. Dr. Pam not wearing 6-inch heels is harm reduction because I'm old and I still like heels and whatever. That's a different question, right? Okay. So harm reduction says specifically that the problem has been around for a long time. And instead of saying, just stop doing it, we're going to say, if you do it, choose to be safe. Okay. Harm reduction is if I am working with someone who is in someone who sells their body for sex, I'm teaching her to be safe. Okay. So now read all 4 of my choices.
A, respecting a person's identity and helping clients recognize their inner strengths. B, recognizing a person's flaws, rejecting them, but not rejecting the person. C, allowing the burden of society's criminals to fall on the shoulders of a community to solve. D, practicing outside the social work scope of practice. So I would eliminate D because that has nothing to do with the question.
Okay.
And C, allowing the burdens of society's criminals to fall on the shoulders of a community to solve. So now I'm between choice A and B. So I'll go back to the question, which is about harm reduction. And it says, this supports some of the most fundamental precepts of social work practice, which are respecting a person's identity and helping clients recognize their inner strengths. Or B, recognizing a person's flaws, rejecting them, but not rejecting the person.
Okay.
I'm not sure that I like either one of these, but it doesn't really matter because no one asked me what I think, but these are my choices. Okay. So I'm looking at the best of the 4.
Right. So harm reduction, basically, like, you're taking the person as is, regardless of their addiction issues. It's not about what your addiction is. It's about your safety as a person and trying to make sure you're safe while, whatever your addiction is. And I think the answer that really resonates with harm reduction, I would say, is B, recognizing the person's flaws. Well, actually, hold on. Let me go back. Respecting a person's identity and helping clients recognize their inner strength. I'm gonna stick with B because you're not rejecting well, this is tough.
I would agree and it was supposed to be tough. It's written that way. So that's what I want you to do is you've got, you know what it is. Like I know this stuff, but I want you to be able to understand when I'm down to 2 and the question is not written. The task is not easy. So what's the best answer?
Will it be B?
Tell me.
It says harm reduction as an approach.
I'm sorry.
Provide.
Did you change your? Was there a voice change? Did Tasha ask for
Oh,
help?
I'm sorry. I thought we were all helping each other.
Okay, Tasha, do you want help or do you want us? Do you, Tasha? You tell me.
Actually, no, I think it's B,
He
because I was
supports
actually
some of the most.
thinking, I was thinking like, okay, where it says not rejecting the person, because regardless of their addiction, you're not rejecting them because of that. But when it says recognize their flaws and rejecting them, I'm like a part of their, well, I'm gonna say B. I don't know. I could be wrong.
We gotta figure it out. We gotta figure it out. If I'm not there and it's on test question,
I think it's B, because B kind of resonates with harm reduction, because
recognizing a person's flaws, rejecting them, but not rejecting the person. Okay,
yeah,
go back to my question. Go back to my question. Did I mention it was a reading test?
right. That's what I'm saying. Like provides
Okay, go back to my
non-judgmental
okay.
and non-coercive services for people who uses drugs and alcohol. And then because A
So
says
non-judgmental belongs to who? Do you know what theory that says? That's person-centered, right? The client is the expert.
right. Ah, okay. I see what you're saying. I see what you're putting down.
I'm just reading. Non-judgmental, non-coercive. I'm not putting pressure on them to stop using. This is okay. I think most of you would say this is a pretty typical test question. Like, damn, I'm Dr. Pam didn't teach me this, and I don't know what the best answer is, and I don't know what to do. So how do we figure out the best answer?
So
yeah, so
right.
A. I don't
Prove it
know.
to me.
Because it says respecting the person's identity and helping clients recognizing their inner strength. Like the goal is not to stop you from using, but also to help you recognize like you can practice, safety while you're using, but also we can also help you if you do decide to stop using.
Okay. Ding, ding, ding. Let's go back to the question. Provides
Lord,
non-judgmental.
right.
That is Carl Rogers. That's person-centered. If I don't have I'm not judging you.
Right. That's where I was like maybe B, because it says recognizing the flaws. But then when I see rejected them, I was like, okay, that doesn't really resonate. But then it said not rejecting the person. I was like, okay, that last part and the first part, the answer goes together. But the rejecting them is not really making it
Carl
right.
Rogers said that people
yeah.
are the experts in their entire their life.
Right.
Okay. This is who you are. Okay. And I'm gonna sit back and listen and help you figure out what's best for you. I'm not gonna say anything.
Right.
Okay. The goal of person-centered is to help you get to be the very best person you can be.
Mm-hmm.
Okay.
Got it.
Okay, guys. I'm gonna pull up. Say again.
I forgot about Roger.
So remember, every test question measures something. Every question is measuring a knowledge, skill, or ability. So whether it's the LM or the LC, I still have to know the terminology. I have to know what Carl Rogers said. He's person-centered. So he is different than Freud, because Freud said, oh, look at me, you poor dumb women, I'm the expert. And Carl Rogers said, no, the client is the expert. Carl Rogers said that we don't even diagnose. We're not going to have a diagnosis, because that means whatever my client is experiencing makes them crazy or gives them a psychopathology, gives them some kind of definition, right? And we're not trying to do that. Okay, let me go back. Let's see here. This is a recall question. A recall question means I just have to know the content. I'll put these the answers in your chat box for this test, the LSSW exam 4. Vicky, have you had a question?
Not yet.
Okay.
All right. I did this last week.
Okay.
The answer is A.
Okay. Go back down. I'm going to put these answers in your chat box and come with a different set. So hang with me. Did anybody do any questions this week that they're not sure about? Any when they went over these?
Let me look. Oh,
I'll put the answers in your chat box. I have no problem with that. I just want to make sure you're understanding content more than anything.
oh. I have a question, Dr. Pam.
Yes.
Question 19.
Go ahead.
It says Lewis forgot to write a report about a client in a timely manner. In order to complete the entire report, Lewis filled out some of the information he did not remember using. Report. Lewis filled out some of the information he did not remember by using reports from other clients in similar situations. What best describes the ethics of this scenario? So it's an ethical question. The question is asking me, is it okay did Lewis make an ethical decision about using another client's notes that came from a similar situation? And the answer choices were A, Lewis' actions were unethical because there is a violation of falsified information on a report. B, Lewis's actions were ethical because he filled out the information to the best of his ability, considering the circumstances. C, Lewis's actions were unethical because he used other clients' information at a time where he was not supposed to. D, Lewis's actions were ethical because the clients were in a similar situation. I said it's A, Lewis's actions were unethical because it is a violation of to falsify information on a report. And I said that because in the question it says, Lewis forgot to write a report about a client in a timely manner. In order to complete the entire report, Lewis filled out some of the information he did not remember using reports from other clients in a similar situation. First and foremost, we don't go to other clients' notes like that to refer to, which is not another client situation.
Let me share my question. Let me share my screen now because I'm not sure what number that is.
Maybe I should be up some.
She said 19.
19.
And my questions aren't numbered, so I'll have to go through. It's Lewis. Am I showing my screen?
Yes, you are.
Yes, I can see yours.
Okay, so American 1, 2, plus 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. There we go.
Yeah, I
Is it-
said A
Dang, dang, dang.
because it's not the same situation, but more notes to fill out information missing that we didn't remember.
Mm-hmm.
That just is unethical. It's falsifying documentation because we don't know if that actually happened with during that interaction with the client note you're filling out.
Good with that?
Yeah.
Okay. I can keep going if you've answered these. So this one, did everybody answer that one?
Which one is that?
So if this was 19, this would be 20. A social worker?
20. I did. It says a social worker is in a hospital setting is meeting with a patient after surgery. A patient is talking about her new port that has been surgically installed about 3 inches below her collarbone. Which referral would be most helpful to this patient at this time? So
This
the
is
question, we know in the
Go ahead.
and the question, we know it in a hospital. It's a hospital social worker. The patient is talking about a port that has been surgically installed about 3 inches below her collarbone.
Right here. This is a
We know that
medical
the answers
question.
are a medical question. So our choices are A, dialysis support group.
Dialysis.
B is
If
cancer support
hold
group.
on. So if I have a dialysis, somebody know where the port goes?
Kidney issues.
Got it. So I may do a port in my arm, but it's here, and I may do a port in my stomach. If I do hemodialysis, this is the bachelor's level question. So if I've got dialysis, I've got to have either a port here or sometimes hemo is in my stomach.
Right.
Okay.
So B, cancer support group. D, diabetes support group. C, infertility support group. I canceled out D because I don't know about any infertility support groups that would put
style support. So one of the reasons I have a port is because I'm getting regular treatment.
Yeah.
Okay. So you don't have to stick me every time. Right?
Right.
So I would take out infertility because infertility is a shot maybe, but you don't have to stick me every time.
Exactly.
Okay? So C and D were out. Okay.
I took C out because diabetes support group may be more about medication, maybe complications you're experiencing. I took D
and
A out.
Hold on. So I might take, if I'm diabetic, I might have to take my blood sugar, but I don't usually have a port. The port is I'm getting regular treatment, so you don't have to stick me every time. So I have a port. We can just put it in. Okay.
So this question, we have to know what it's meant by a port.
Ding, ding, ding. And this is something you would learn at that
dialysis
BSW level. Okay.
I took out the dialysis because I connect that to the kidneys, and I don't see where a port has to be on your collarbone.
It does, but it wouldn't be here. You're absolutely right. You're absolutely right. The port would be either in my arm or usually sometime in my abdomen. You're absolutely right.
I said the cancer support group.
Ding, ding, ding. Anybody struggle with that one? That is something that you learn at the BSW level. And that's the question. The LCSW does not cover this. It does not. But that is knowing just knowing about everyday human development and knowing the basics of medicine. Good. Very, very good job. Want to ask you about that one, guys? A port means I'm getting regular treatment. And that's the goal of a port, is because so every time we come in, you don't have to stick with the needle. Okay. So port is that they put a opening here or in your arm. So if you're in any kind of treatment, they just put they can hook the IV up to your port and not stick you every time. My husband died of complications of diabetes. So I know a lot about the medicines that I wish I didn't know, but that's one of the reasons you have a port. So you don't have to get stuck every time. Okay. That's basic social work knowledge that everybody needs to know. And that's what you'll find that in the BSW level if you don't know that.
Yeah,
Go ahead.
I had another question on question 37 and question 36.
Okay, hold on. Okay, so we decided that Lewis was 19, right?
Lewis is 19.
I gotta start. Okay, so
Action
what does it
38.
say? Just tell me what it says. I can. What's the discussion
Number
start with?
36. Sylvia has been in treatment for 6 months. When you become concerned, she is not telling her psychiatrist everything. You have a release of speech to the psychiatrist that is still valid to discuss the patient's symptoms and treatment plan. You should. So it's talking about Sylvia is the patient. She's been in treatment for 6 months. You must be a friend or family member, significant other, and you find out that she hasn't been forthcoming with her psychiatrist. There's a release already signed that Sylvia gave you, or it's a release already signed. It's still a valid release. So you want to call the psychiatrist to discuss the patient's symptoms and treatment plan. The choices are A, call the psychiatrist and discuss Sylvia's symptoms and treatment plan. B, ask Sylvia to sign a new release to discuss her resistance to opening up with the psychiatrist. C, confront Sylvia because she is hiding things from the psychiatrist. D, wait for Sylvia to bring up the truth to her psychiatrist.
So I'm going to go back. Hold on. I'm going to go back to the social work planning model. And I know it says next, but whenever I see next, my mind goes to first. What would I do first? I want to gather more information. Which one of these helps me gather more information? What would I do first?
A.
Ding, ding, ding. Okay. Why is B wrong? Anybody?
Because, okay, it's still valid.
Exactly. It's only been 6 months. It's still good. I don't have to do B. C, confront her. I only confront when the mouth and the body are lying. Okay, I'm not going to confront her. And if we wait for Sylvia to bring up the truth, we could be here for 27 years. So whether it says, because it says next, I'm thinking, what would I do first? Everything is considered a first question. Assess, assess, assess. Yes, we're good with that. We understand how we got there. Okay, keep going, Vicki. That was 27. Sylvia?
36.
So it was 36?
So 37. A social worker has a 16-year-old female client who's a cheerleader at her high school. She recently broke up with her boyfriend, who is a football quarterback. She is now dating one of the other female cheerleaders on her team. Though she has never dated a female prior to this time, she has expressed that she may like to get her old boyfriend back. This client is most likely.
So stay in my question. Has she had sex with anybody in the question?
It doesn't say that.
Ding, ding, ding. There's no, she didn't say I did this girl, I did this boy. So she dated a boy and now she's dating a girl and she's
Yeah.
not sure.
So the question is asking the client is most likely, and it lists A, bisexual, B, questioning, C, lesbian, D, transgender. I pulled out the sheet you gave us with the LGBTQA information on it.
So transgender means I'm unhappy with the gender and I'm trying to change genders. Okay. Lesbian means that I like girls. I'm a girl that likes girls. And bisexual means that I like both boys and girls. But
I
I
said
would,
A, bisexual.
okay, but in the question, has she had sex with anybody? Bisexual means I've had sex with both people. Does it, in the question, has she had sex with anybody?
Well, the sheet you gave, the question says no, but the sheet you gave me says the term refers to a person attracted to two or more genders. This could be a person attracted to men and women, a person attracted to men and non-binary genders, or as a person attracted to their own gender and few others, while bi does not refer to two. As the community understanding of gender has grown, the term has expanded to in its usage to gender binary. I also said questioning because a term used to refer to someone who is not sure what their gender identity or sexual orientation is, and who is in the process of figuring it out. So I took out C and D, and I went back and forth between A and B, but I landed on A. I landed on A.
And I
Because my
realize,
understanding was more of A than
okay.
B.
So let me clarify. So in this question, bisexual means I've had sex with somebody.
Okay.
Okay. And she hasn't had sex with anybody yet.
We don't know.
Okay. So for this question, it doesn't say that she likes boys or girls. We're not sure. So sexuality means that most often, and I get that the definition says I'm attracted to, but in this question, the best answer is she hasn't had sex.
Okay.
I can't prove bisexuality. So questioning is the best answer.
All right.
Okay. What number was that one? 37?
I don't want to take over the group. I'm done. I have others,
Okay.
but
I don't know that anyone else has gone that far. So anybody else want to ask the questions? I'll put the answer in the chat box, but if you've gone through the questions, Vicky, let me help you.
Can you go with number 35? Because I had a hard time with that one. I can't figure out why I'm confused.
Is that
Or
Sonia?
why I think it's number C, but it could be A instead. It says Sonia, a social worker, has a client, Sophie, who is a recovering alcoholic. Sophie has completed her court-ordered treatment and now seeks to be reunited with her children, who have been placed in foster care. Sonia first networks with.
Okay.
So she is the court order. The courts are already involved. The children are in foster care. She's a recovering alcoholic.
Whoa. She's completed her court order treatment. She's done that already, right?
Yes.
And now she's ready to be reunited with her kids.
Yes.
So then I've already created my court order. So legal aid is free. Legal aid means that if I don't have any, I can't afford to pay, legal aid will help me. So C and D should have been out.
Okay.
So you should have been between A and B. Is it Child Protective
B.
Services or court? Okay.
I said B because they're already placed in foster care.
But the question says she's already complete. She did what she's done with the court. She already completed her court order treatment. She did that already. She's done with the court.
So she's going back to Child Protective Services to reunite with her children.
Ding, ding, ding. So
yeah, but it says Sonia, but Sonia is a social worker, and the client is Sophie. It's saying Sonia's first networks with. So I think it's asking about the social worker, not the client.
I agree. Okay. So my client has already finished their court order. She's released from the court.
But
So I don't need to call the court because she's done with the court order.
so Sonia has to call Child Protective Services to know that she's done.
So there should be in the real world, I'm hoping that the CPS worker or the foster care worker would say, hey, she's in a court, she can get her kids back. Right? Because she's already did what the court asked her to do. In the real world, I'm hoping they say, hey, okay, good, we'll get your kids back. However, the court is done. The key in the question is she already completed her court order treatment. She did what she's supposed to do. So the court is not going to have an answer for me.
Okay.
And this is one where I have to know how it works in general, not just in your state. So what happens is how it's supposed to work, whether how it works in your state or not. Okay. So somebody calls in and says, oh my gosh, Dr. Pam is beating her kids. She's beating her kids. So a CPS worker goes out and they investigate. They decide whether or not Pam is beating her kids. So if they decide that Pam's kids are in imminent danger, right? Pam's going to beat them tomorrow, then that social worker is going to take them from the home immediately. Within 24 hours, they have to go for a judge. And the judge is going to, in the test world, side with social worker and say, hey, good job. You protected these kids. Okay. So now I'm going to give the mom and dad 30 days to come up with a treatment plan. So between the DFACS worker, Child Protective Services, we'll come up with 30 days of what's her treatment plan. Mom needs to go to drug and alcohol. They need to get a GED. They need to get jobs, whatever the court decides. Okay. The goal is that we don't want children to remain in foster care more than 18 months. The younger the children are, the more we're going to stick with that. We do not want children going to 15, 16, 17 different foster homes. We don't want that. Okay. So now I've given mom and dad a time limit. This is what you need to do, A, B, C, and D. If mom and dad do what they're supposed to do, then the court says, hey, we're done. You're kids. What often happens in the real world, not the test world, in the real world is mom and dad have had 2 years. They haven't done nothing. And the judge says, oh, give them more time. They'll be fine. But in the real world, in the test world, we don't want that. We don't want kids being in foster care for more than 18 months. Mom and dad, get your act together and give up your rights so we can put these kids in a permanent home. Permanent placement means they have a permanent home. They're not shifting from foster care to foster care to foster care. You learned that in school. You did. Okay. So in this question specifically, because she's already done her court order treatment, there's no reason to contact the court.
Okay.
Hold on. Anyone other than Vicky have a hold on. Anyone other than Vicky? Hold on, Vicky. Anybody else have a question about the ones you did already? I put this in your chat box. We can go over it so I can help you understand why it's the answer. Tasha, what number did you get up to?
I didn't go over the questions really. I was just going to reading the book and just trying to understand content.
Do you have any questions for me?
I do actually, because in chapter, I think finishing up chapter 5, it talked about the changes that's been made to the DSM-5 and how I think they eliminated
an LM or an LC?
LM.
Okay. You're gonna get about 4 or 5 questions. Oh my God, I hate those questions. I hate those questions. I hate all those questions. We're on the DSM-TR. I don't understand why we still has those questions. I really don't. And
I know throughout my study journey, I have encountered practice questions that asked about how they change. I think it's like the non-specified
NOS, yes, NOS.
To other specified or something of that nature. And I was like, wait, what? And so, and how they remove, what is it? Hudas to, what is it? Golf or golf
Okay,
or
so
something.
the DSM-3 had the GAF. Have you ever seen?
No, I haven't seen a copy of it, but I have the old DSM-5.
Okay, exactly. So the DSM-4 had the GAP, the global GAF. It's your global effective functioning, and it was a scale from 1 to 100. I haven't seen that in forever. Recent test takers, are you still seeing that question? Those questions, the difference between the DSM-5? God, please let those go away, because we're the TR. We're the TR.
I've seen questions about the other specified or the
Yes.
unspecified. I've seen questions
Okay.
about those, not the changes that were made.
So NOS versus OS.
The term.
Share my screen?
Yes.
So the term NOS has been replaced with other specified disorder. And that's just one of those factual things. I'll put that in your chat box, but I want to tell you, if that's the only question you're missing, you'll be fine.
No, it's not. But that's a lot of information.
I have a question. It's from the reading though. Like, if you can tell me a little bit more about the trauma with kids, or the technique or questions on the test on trauma with kids.
So are you talking about trauma-informed care?
Possibly like during the assessments or the theorist or something of that nature.
Okay, so in general, we talk about trauma-informed care. What does that mean in general, guys? Okay, so trauma-informed care implies that everybody who comes into your office has gone through some kind of trauma. Okay, that is the assumption. So what that means is when someone comes into my office, I am going to always ask them how they feel. Instead of telling them what to do, I'm always going to say, hey, is it okay if we do this? Trauma-informed care means that the assumption is that everybody who comes in has gone through some sort of trauma. I taught this to my a dental group this week who I talked to a dental group because one of the things is if I've gotten through some kind of trauma, I treat me differently. So one of the things that we know in general is dental hygiene is usually with people who are upper middle class, who have money. So if I'm poor, if I didn't grow up with all those things, then I probably have not spent time at the dentist. So I spent a couple sessions teaching dentists to understand that you need to use trauma-informed care. You need to assume that people who come in with you who have bad teeth have gone through some stuff. They grew up in a place where dental hygiene wasn't the priority. They grew up in a place where safety, where making sure that I'm okay is the priority. So trauma-informed care is how the agency works. We're going to make sure that every member in the agency assumes that the people have come from a place where they have not had a choice to make decisions. So when someone comes in, I'm going to say, is it okay? Do you mind sitting there? I'm going to make sure I ask them if it's okay instead of telling them what to do. So the goal of trauma-informed care is that we assume everybody that comes in our door has gone through some sort of trauma. So we're going to give them some power and control. The book talks about, in general, of how we dress. We're going to make sure it doesn't look like a medical setting. We're going to make sure that it is not like I'm the boss, tell me what to do. This is what you do. We're going to ask. We're going to make sure that the dress is appropriate. We're going to make sure that the environment is appropriate. Do you mind having a seat in that chair? Is it okay with you? So trauma-informed care is definitely always on the test. And that is something in general that we should always know how to do. So whether just because we work in a whether we work in a trauma agency or in general, the assumption is that we're always going to assume that everybody that comes into our office has had some trauma. In the help in the APGAR book. I'll always say to you, she's the hardest to read, but she's the very, very best book for content, even at the BSW level. And I like that one because there's assumption that there are things that you should have learned at the bachelor's level, and this book is so much easier to read than the others. Did you guys all get the link to join Sunday group? I have group every Sunday from 6 to 8-ish. And what my company decided is if you pay for any kind of session, we're going to include you in our Sunday groups. So you should have got a link this week and next week, just to make sure that you enjoy, you're invited to our Sunday group sessions. You should have got a link.
6 p.m.
6 to 7:30 EST, yes.
I got the link, but I didn't have previous plans.
And that's really okay. 164 to 165. If you
Oh my gosh, I'm sorry.
If you go back to the link or go back on your page, there should be the recording from the week so you can watch it.
Dr. Pam, I'm still having a hard time with the recordings. I go to the website on my desktop and I still cannot find the previous sessions that we are recording now to review them. I mean, I can reach out to your team tomorrow during my lunch break and have them walk me through what I'm doing wrong. I'm having a difficult time.
So, okay, yes, because I'm sorry. I love this. I can tell you, but I don't know. I don't know. Okay, there we go. So this is the bachelor's level. Did I give you all this book at the bachelor's level?
Mm-hmm.
I know that you're LM or LC, but I like the bachelor's level because it makes it so simple. It's much simpler than any of the others. Okay, so trauma-informed care organizations, programs, and services are based on the understanding the vulnerabilities or triggers of trauma survivors. Okay, we don't want to make their problem worse. Trauma service delivery approaches may exacerbate, make their problems worse. That's not what we want to do. Trauma-informed care may be viewed as an overarching philosophy and approach based on the understanding that most of our clients have suffered trauma. Okay. In the master's and the bachelor's and the master of the clinical level, it says the same thing. It uses bigger words and doesn't give you as many details, but trauma-informed care is something that we should have learned at the BSW level. So that's why I say go back and read this book. It's important for social workers to understand trauma and how it affects people regardless of their diagnosis or identified needs. Thus, in everyday practice, social workers need to recognize how the organization, programs, etc., talk about trauma. So one of the things, and again, I want to bring it to, I always want to think about everyday life and not just trying to understand. So we're looking at Asheville, South Carolina, and all those things that are happening. So the first responders are going to make sure they get the basics, Maslow's, right? Food, clothing, shelter. In a month from now or 2 weeks from now, when the basic needs are met, what are those people going through?
Trauma.
So, right? So acute stress disorder, right, is between 3 and 30 days. If they don't get any mental health treatment after 30 days, it turns into PTSD, post-traumatic stress disorder. As you're watching the videos, if you're watching what happened, I want you to wear your mental health hat. That FEMA goes in and gives the basics, right? Maslow's basics needs. But once I have food, clothing, and shelter, do I still have issues? I've gone through some trauma. I've gone through losing everything I know. This is a flood of biblical proportions. I've watched everything I own go away. I watched my neighbors die. So that's when you're watching the news, that's why I want you to be thinking, oh my gosh, from a clinical standpoint, what would I do? What would I do? Okay. This is not just test questions. This is how we operate. The code of ethics says pro bono means I'm going to give my services to people in crisis. So the code of ethics says that, once they get a place to stay, I should go and give them some free trauma-based services, some free PTSD services. That's what it looks like in the real world. Okay. So that's where we're coming from when it talks about trauma-informed care. Ask me other questions, guys. If not, I'm gonna get Vicki the floor.
I have another question.
Okay, girl, if you did your homework, you paid like everybody else. I'm gonna make sure you get your needs met. So keep asking me.
All right. Number 39.
What does it start with?
Penelope.
There we go.
Penelope. Do I have to read it?
Penelope.
I was just about to ask about that question.
Okay. A social worker at a community clinic recently lost her daughter in an accident caused by a drunk driver. Oh, it's the code of ethics. Code of ethics. Oh, I know this question. Okay. So Penelope, I'm a social worker, right? I lost my own daughter in a drunk driving, and I went to a group, right? And in the group, I realized that, I met this person and we're in the same place. He lost his kid, I lost my kid, and we've connected. We had coffee, and I began providing job training and services for Joan. I have seen Joan first, haven't I? Joan's been my client for a long time. She's a single mother, and I've been seeing her for the past 15 months. And then I realized that the guy that I have hanging out with is my client's brother. As much as I like my client's brother, and as much as it's good for me, who's my priority?
Joanne.
Absolutely. So then At her last appointment, Joanne's brother comes to pick her up because he's starved in the shop. And it turns out, oh, hey, Jack is the guy I've been hanging out with. Are there any questions that talk about what's best for me? What is best for my client? Okay, can I get rid of Penelope?
No.
Do I need supervision? No, I do not. Supervision is very rarely the right answer.
No.
So now between A and D.
I said the answer is A. I said
So-
A. It's A because your
My
priority is
client,
Joanne.
exactly. My client comes first. Yes, I have my own stuff I'm dealing with, but I don't get to deal with my stuff because I'm a professional. My client comes first.
First.
I got this degree, I got this license to take care of my client, not about me. There's no test question that ever asked about what's good for you. What is good for your client? Tasha, you want to process that?
No, I came up with the same answer, but
Okay.
it was a heavy read. I was like, I think it would be good to go over, so I was gonna ask about it. But
Okay, okay. I have 1,000 test questions. If I give you test questions, if you do them, I can give you more.
Okay.
Okay. So if I give you the assignment, just go over them. And remember, I don't ever think test questions are studying. I do not. I want you to stick with content and understand the book and understand the videos. But if I give you test questions, work on them. Okay, keep going. So Penelope was what number?
39.
Okay, you want to keep going?
Let's do 40. Oh, you want me to read it? Some of the key techniques as a leader in a social services agency uses can strengthen individual employees, thus contributing to the team as a whole. Which is the following is not an example of one of these techniques.
Okay. When the question, what is it? Tell me in your own words, what's it asking me?
It's saying there's some key techniques that a leader should employ to strengthen his employees and make the team work more productive and together.
So this is an independent, so direct practice, right, is with the client. So this is an indirect question.
Yeah.
And it's asking me as a supervisor or leader, what do I focus on? Right? This is an indirect question. Every
But it
question
says
measures a
which is
KSA.
not the following.
So I'm looking for 3. I start with which
is
3
the
things do I do? Right? So I'm a leader.
Which is the following and not
I'm going to start off
which
with what
is the following
would
is
do
not
that.
an example.
What would
What
I
would
do?
you do?
Yes.
You would do
Okay.
C, be genuine.
I would. Okay.
You would do D, use mistakes as growth opportunities.
Absolutely.
You would do A, engage in active listening.
Okay. So document
So
all conversations clearly and retaining records. Why is that the best answer? Go back to my question. Prove it to me.
The question says some of the key techniques a leader in a social services agency uses can strengthen individual employees. So you're looking at your employee as an individual and find out what best can make them stronger as a member of your team, which then can help their client. This contributes to the team as a whole. Which of the following is not an example of one of these techniques? If you're just documenting conversations clearly and retaining records, you're not really pouring into your employee what they can do better. You're not really supporting them and bringing out their best. You're just typing it up and putting it away. They can choose to look at it or not look at it.
Dr.
But then
Pam
this
did
is-
this wrong. Dr. Pam did this wrong. Dr. Pam did this wrong. That is not what I need from my supervisor, is it?
No, you need engagement. You need encouragement. You need to.
Absolutely,
young-
absolutely. I told Dr. Pam how she effed up in this situation. So of the 4 choices, I would not focus on what I did wrong, what my supervisee did wrong.
All right. I thought it was B anyway.
Okay. I would not document, and I told, so I think this is one of those tricky questions. So as a supervisor, if my supervisee is messing up and I told them stuff and they keep messing up, I will document everything. I said to the client, I said to the supervisee, do this, this, and this, and they didn't. Okay. However, this question doesn't talk about one individual person. It talks about, I'm trying to strengthen each individual. So remember, we focus on the strengths. So I'm going to focus on what the supervisee did right. And the key to that question is the strength.
So I have another one if people want to keep going.
Wait, I got one. Hold on.
You do? Thank you. I'm out
Yeah,
by myself. Thank you,
Yeah,
Tasia.
no problem. I don't know what number this is, but it talks about the Stoltenberg's integrated
Yeah,
development.
I skip that one. Skip that one. That's
Okay, because
that
I was
is-
like, I don't know what they're talking about.
yes, thank you. So if you've never seen it before, ever, don't worry about it. Okay. Keep going now. What else do you have?
The one that talked about the Carter family.
Oh, that was a Freud question. I love that question. That's in the beginning. That's one of my favorite questions. I use that all the time.
Oh, actually, we already did that question. Never mind.
What? But obviously you had issues with this. Let's talk about it. Girl, you paid an
Everybody
arm.
might remember.
No. You paid an arm and a leg to be with me. Get your money's worth. I'm the best prostitute ever. You paid to be with me.
What
What you
number was
want?
it? Oh, this was an interesting one. This was a hard one, though.
Honestly, you paid to be with me. To get all the, let me spill everything I know into you. Okay, so the Carter family comes to therapy with their 4 children. They're all engaged in different activities. Ed sits on his mother's lap, sucking a toy. Trisha wants to show the social worker how she's good at cartwheels. Jackson announces his sister doesn't have a penis. And Philip sits on the floor saying he doesn't have to go to the bathroom. Which of the following identify who's in the latency stage? It's a Freud question. Oral, anal, phallic, latency, and genital. What happens in the latency stage?
That's the beginning
Things
of
that-
when they put things in their mouth.
No, oral.
Yeah,
Okay.
I think that's the only stage I don't talk about anything.
Because nothing happens. In the latency stage, nothing happens. There's no sexual input at all. So OAPLG, oral, anal, phallic. So Freud said if my mother satisfies my oral stage, I'm good. But if she doesn't, I'm a grown adult still sticking things in my mouth, right? Because I'm stuck in that stage. Anal, right? My mama didn't satisfy the anal stage, so I get fixated in the anal stage. The phallic stage is when I find my toy box. Right? If my mother doesn't satisfy that, Freud always said it's her mother's fault. Then, as an adult, I'm billing like a man is billing like that Washington Monument, like these big old phallic symbols, or I'm driving a F-250, the big old truck, because I got a small thing. Right? That's what Freud said. In the latency stage, nothing happens. It's hidden. Okay. So then let's go back to the question. So what I know is Jackson says, my sister doesn't have a penis. What stage is Jackson in?
Valid?
Oh,
Oh.
phallic. Ding, ding, ding.
Oh.
Ding, ding, ding. The phallic stage. Okay. Ed sits on his mother's lap, sucking on a toy.
Yeah, I knew he was in the oral
Ding,
stage.
ding, ding. So he's out. And
Wait, who sit on the
okay, so
floor?
I took out Jackson because Jackson says he doesn't have a penis. Ed sits on his mother's stage, sucking on a toy, mouth, oral. Philip, what does Philip do? Philip says, I don't have to go to the bathroom. What stage is that?
Anal.
Ding, ding.
No, I don't know. Oh,
Yes. The grown adults say, oh, hey, by the way, I don't have to go to the bathroom.
sometimes.
He's in the anal stage. He's in the anal stage. It's potty training. Okay. Trisha wants to show the social worker how good she is at cartwheels. Is there anything sexual about that?
No.
If Trisha says I'm not wearing any panties when I do a cartwheel, that's a different story, right?
Right.
But all it says is she's doing cartwheels. There's nothing in that stage that talks about sex or any of the Freudian stages. Freud says OAPLG, oral anal phallic latency in general. I said to you, I hope that I use it now. Old ass Pam loves gold. Okay, oral anal, orphan Annie, pretty little girl. What Freud said in those first three stages, oral, anal, and phallic, is if my mother doesn't satisfy those stages, I get stuck or fixated in a stage. So the question might say, I'm an adult, and the client says, I eat all the time. But I don't remember eating. I'm gaining weight, and I keep putting things in my mouth, but I don't remember, because she's fixated in the oral stage. All right, so the only one in this question that has nothing to do with psychosexual is Trisha. Get your money's worth. You paid a lot to be with me. Pick my brain. Come on.
I gotta think this a little bit more.
Ask me other questions. You got about 5 minutes left because it's way past my bedtime.
Okay.
Any ethical question?
We're not doing code of ethics yet, but I can pull up some later.
Oh, sure.
Okay.
Next person, 5 minutes.
Okay. So
Later.
anybody have anything on this one? Anything else on this one?
Yeah, there's one that says a 6-year-old boy is referred to you for counseling by his teacher. Right there. Oh, where you at? Right. Yeah.
Oh, okay. I like this question. Keep reading.
A 6-year-old boy is referred to you for counseling by his teacher. In session with you, he throws things and runs all over the room. You observe that he uses his body continuously in destructive and aggressive ways. What would concern you the most about this child?
Okay, so stand my question. In this session, he throws things and he runs all over the room. And his body is continuously destructive. He's just like flailing, always like making a mess, like, oh, everywhere, right?
Right.
I want you to picture, okay? So then what would I worry about most? Is he suicidal?
No, I didn't say suicidal or depression, but I was between motor skills and brain damage. So I was.
That's where I should be.
Sure.
That's exactly where I should be. Okay. So he's 6.
Right.
That matters. He's 6. Okay. If I have issues with my motor skills, where does that come from?
Like development. Like your brain.
It's a neurological problem.
Right. Okay.
My brain tells my arms and legs how to move.
Right.
Okay.
So-
So my concern is at 6 is that I would do a biopsychosocial. What happened at birth? Right.
Right.
Okay. Did he develop at the right stages and ages? Did he sit at the
Yes.
right time? Did he walk at the right time? That's what I'm looking for. Motor skills are based on how I develop at 6. So neurodevelopmental disorders are based on how my brain develops, right? ADHD, autism, any of those things are as my brain is developing. Neurocognitive disorders are later on. That's Alzheimer's, right? Now my brain doesn't, so neuro is brain, cognitive, my brain doesn't think the way that it used to. Something's wrong. But neurodevelopment is as my brain is developing.
So wouldn't the motor skills disorder, well,
Where do motor
assuming he's-
skills come from?
right. Right. And then mild brain damage.
Is because motor skills come from here at 6.
Right. So with the social worker we concerned about?
Yes, as
Oh.
a social worker, you're supposed to know that
We
motor
are supposed to
skills
know.
Yes, you are. Yes, you are. You're supposed to
that
know
we-
normal human development. You had a whole semester on HBSE, human behavior and social environment. Yes, you do. You're supposed to know normal human development. Yes, you are. That's why I gave you the bachelor's level, because you learned that.
Right, which is why I was saying motor skills.
However,
Yeah.
motor skills develop
Right.
in my brain. That's a neurodevelopmental disorder. As my brain is developing, that's where it comes from. If it's said Pam is 57 and now she's paralyzed, that is a body thing. But my brain teaches me how to walk and talk and do everything.
Oh, okay. I see what you're saying, because the motor skill is basically how the milestones that he hit throughout his
Did he
developmental
walk at the
stage.
same age? Did he talk
Right.
right at the same age? Can't exactly. At 6 months, he should be able to sit up.
Right.
At 6 months, you should be able to sit up. By the age, so most babies walk by 1, but we're not concerned until they're 18 months.
Right. So motor skills is not a disorder.
It is not. It is a
It's a
brain disorder.
right.
But if I
okay.
lose motor skills as an adult, right, that's a neurocognitive disorder. So ataxia, do you know those terms? The 5 A's of Alzheimer's?
Yes. I saw a question about that the other day.
Okay, keep talking.
Well, I can't really pronounce the names. But I know one is like apaxia or
Okay. So you're always going to
aphasia.
yes, you're always going to get one of these. Always, always, always.
Yes.
And you need to know these, okay?
Yes.
And again, I will say always that this book, that she's the best one that talks about these, okay? Am I sharing?
Yes. Yes, ma'am.
Okay. So last year, and I haven't watched NFL this year. Last year, if the football players had a head injury and they couldn't walk a straight line when they got off the field, it's called ataxia. The way I remember that is they couldn't run to catch a taxi. Ataxia, right? So that's a brain issue, and my motor skills, I can't run to catch a taxi. Taxia. A negates the word. So I cannot catch a taxi. So if you get off your gate, right, if you had a brain injury and the NFL said cannot walk off, if they cannot walk off the field in a straight line, they can't play. A brain injury helps them, they can't walk. Okay. Ataxia is the taxi. Okay. So apraxia is I cannot misuse of objects, but I don't know what they do. Apraxia, I was thinking about three. I don't know. I see a fork, but I don't know what I'm supposed to do with it. I go to brush my teeth with a knife. It's a toothbrush. I don't know what to do with it. Agnosia is I don't. So agnosia is I don't know how to use the knife. Agnosia is I don't realize what it is. If I put PROP in front of that term, that means I don't recognize people. So propanasia is I don't understand, I don't recognize people. When I got Alzheimer's, right? When I have neurocognitive disorders, and if it's severe, I don't recognize that you're my daughter. I don't recognize that you're my husband. Aphasia. Do you remember Bruce Willis when he very first started? His wife said he's got aphasia. He doesn't remember phrases. Okay. Phrases. I don't know how to express my thought. I cannot get the words out. So aphasia is phrases. So we don't use the term Alzheimer's anymore. We use mild, medium, and severe neurocognitive disorders. So in the beginning, when I can't do phrases or I can't remember your name, it's mild. As it progresses, it gets moderate and then it turns into severe. So the 5 A's are things that you need to know. Okay. Anomia, I don't remember the names of things. Apraxia is I am using the right objects. Agnosia, I don't recognize what this is. Propanasia, I don't recognize names. Amnesia and aphasia. I can tell you, I'm go back to the Apgar book. She's the best. I hate her book. I swear I do. But she's the best about knowing that terminology. Under aging. Maybe Bruce.
I tell you,
Yes.
the more I learn, the more you want to learn. You know what I mean?
So I shouldn't be teaching you anything that you don't already know. I'm just trying to remind you of things you already know. You went to school.
That was like some time for me.
Things haven't changed.
I don't know. I just like, Yes, yes. Reminded me. I'll tell you though.
So this is usually either in the DSM section of how we diagnose, or it is going to be in the section of normal human behavior. Because as we get older, so they're called neurocognitive disorders.
Yeah, it's somewhere in the assessment section, section 2. I forgot. We're in the book.
Okay. So again, so we don't do that anymore. So it's mild, it's major, mild, or severe. So that's how we use it anymore. So it's called neurocognitive disorders, how our brain gets hurt. So no, we used to just call it Alzheimer's in general, but the DSM, the 5 talks about how we diagnose those.
Schizophrenia.
Okay, so those are neurocognitive disorders. Okay, so that's what that question is talking about. Okay, did most of you finish the test? Did you kind of look at it? Where are you at with that, with the test?
I get more questions to do. But this week I'm going to focus more on the book and do some more reading before I start reviewing.
I'm still not going to give you the answers yet. I want you to finish the test. I'm not going to go over the answers because most of my clients just want test questions and answers. I want you to learn. I'll put another test in there if that makes you feel better. I put the bachelor's level test in there. Have you guys done the bachelor's level questions?
No.
I haven't.
I gave that to you, right?
Yes, you did.
I did mention that we suggest that you study 3 hours a day, 6 days a week. I mentioned that, right?
Yes.
Okay. I'm just saying we do what we do very well. It's based on research. We're trying to rewrite your neural pathways. Neuroplasticity says over and over and over again, if you learn this way, that you will be able to understand and change how you think. I can give you content all day long, but if you don't spend time doing what we say you do, you're wasting your time. I want to be in your head. Everybody in your life should know me. You should be playing videos every day, all day. Your kids, your family, your husbands, your spouses should hate me because I'm in your head over and over and over again. We don't ever suggest you study for more than an hour. Research says you don't learn anything after an hour. An hour, same video, morning, lunch, night. If you have to skip one, skip lunch, but do not skip night. Because research says we replay in our brain over and over again, more often what we hear the last hour before we go to bed. That's the research that says that's why you tuck your kids in at night. Because if you tuck them at night, they over and over again replay what you heard them say. It is not based on pulling stuff out of my booty. I swear, it's based on research. My PhD research is how we pass this test, how adults learn. Adults learn if it's important to them. So if you take this and put it in everyday life, that's how you make it a priority. Am I trying to make you a better social worker? Did I ever claim you'll be a better social worker? I'm trying to make you a better test taker. That's it. That's it. Because you pass your exam, will you automatically be a better social worker? What makes you a better social worker is supervision and time. I pray that you have a good supervisor. I really do, because that is really what kicks your butt. I do a lot of supervision. I don't do LCSW supervision, but I do a lot of supervision and I charge a lot. But that's the goal. What makes you a better social worker is having really, really, really good supervision. knowing that you don't take this stuff home on weekends, do you? I always say to the people that I supervise and my students, you know, it's like flipping burgers. If I'm off on weekend at McDonald's, do I wonder if somebody else salted the fries? I do. I could care less. And I'll say to all of you, I know you think you're amazing, and I know that your clients love you, but if you died tomorrow, would they come to your funeral? No, they'd be like, who's next? Who's going to help me next? You ain't that important to your clients. Put it out there. I'll put it out there, especially when you're new in the field. You are not that important. Do not work harder than your clients do. If you die tomorrow, and I'm sorry, please don't die tomorrow. Your family's going to come, your friends going to come, but your clients going to be like, okay, who's going to help me next? Understand the importance of boundaries and priorities. That is what's going to make you a better social worker. If you don't get that in the first few years, you get burnt out and we never see you again. And you still like you've wasted all your time and money. I need you to be a good social worker for 30 years, not 3. Okay. So supervision, boundaries is how you become a social worker, better social worker. I'm teaching you how to pass a test that was not written for you. That is my only goal. That's what you paid me for, is to pass a test. Listen to me, trust what we do. And again, watch this video 17 times. Okay. Finish the test questions I gave you. I'm not going to put the answers in there. I'm not, because most people want test questions. I can put another set of questions in there. I'll do that for you. But I really want you also, I'm going to do that. But no, we're going to finish the questions I put in there. Next week, we'll continue going over those. And I also want you to do the task questions in the back of the BSW book. Those answers are there. They're already there. Do those questions. Remember, I need you to study 3 hours a day, 6 days a week. If you do this one time, you will never see me again. I don't want to be in your life forever. Okay. Also, I hope we changed our policy. So anybody that purchases any sessions with me is invited to the Sunday group. So I hope you got a link late last week on the Sunday group. So I have group every Sunday from 6 to 7:30. The topics change, but you should get a link to that every week while you're still studying with us. So that is my Sunday group, 6 to 7:30. Topics change, but it's on that Facebook page if you're not sure what we're studying. Okay. Okay. Bye, guys.